Stereotypes about pregnancy and birth that are actually true from a labor postpartum nurse. Number one, people poop when they push. This is true. It's not true that everybody will poop when they're pushing their baby out. That's not true. But a lot of people may have bowel movement when they're pushing their baby out. By the time we're ready to push, baby's head is actually quite low, angled back towards the rectum. And we want you to push as if you're pooping. Honestly, I get kind of excited when people are pooping when they're pushing. It means that they're directing the effort, the energy in the right spot. It does not embarrass or discomfort me whatsoever. And I do not want it to embarrass or discomfort you whatsoever. Just discreetly wipe it up. You'll have no idea. Number two, birth is messy. I mean, yeah. You created a human being and now you're bringing that human being earthside. There's gonna be some body fluids involved and that's completely fine. Whether you have a cesarean or a vaginal birth, there's going to be blood loss, amniotic fluid. There may or may not be urine, stool or bowel movements. There may be sweatiness. Your body is working very hard. Mess or body fluid does not equal shame. I've been a nurse for 16 years. I'm expecting there to be some body fluid. I work that much harder to make sure my patient is dry and clean and they feel comfortable. I will wipe. I'm following you with a towel across the floor, changing your undies, we're changing your pad. I literally chose this job. I love it. I want to do this. Number three, if you give birth in a hospital setting, the staff may suggest you turn on your back and put your feet up when it comes time to push. I'm just going to be honest about this. This stereotype can be very true. I'm not trying to be controversial or fearmonger. It's just very common in Western culture. Now that does not mean everybody suggests that. That does not mean you have to do that. That does not mean your nurse will force you into that. ACOG's stance on pushing positions, if it is safe and it's working for you, do whatever position you want. For me, for example, I was standing up by the side of the bed or I was on my knees. For some people, they may love being on their back with their feet up. And I actually work in high risk obstetrics. Most of the providers I work with are very capable delivering babies in all kinds of different positions. There may be birth workers, staff, providers who were trained to deliver babies in that one position. Maybe they don't feel safe catching a baby on their knees on the floor. So again, it is a cultural norm in the United States to be on your back with your legs up when it's pushing. It does not mean it has to be that way. This is just something to be aware of. If it is something you do or do not want, choose a provider who feels comfortable delivering in a variety of positions. Explore your options, have a discussion with your provider, make sure that you and your team are aligned. For more information on pregnancy, birth, postpartum, babies, give me a follow, check out my page.